right.
So are you going to email us Sunday night our?
Yes. Yep. Or probably Sunday morning. All right, so chapter 13, this kind of fits right in, and I think it's funny that even Kanice apparently today was all about cardiopulmonary system. So that's what you guys are learning about this week from all angles, which is pretty cool. That's just a bunch of refreshers. Let's see. All right, so let's do a little bit of an overview. Today's older people are at risk of one or more lifestyle-related non-communicable diseases. Does anybody know what that means? What is a non-communicable disease? Huh? Not transferable. Exactly. You can't catch it from someone. You're not going to catch a heart attack from somebody, right? Another example is like osteoarthritis. Most of these disorders that are non-transferable have some type of a cardiopulmonary reason or a consequence. But what we're going to focus on for the majority is lifestyle modification or intervention, like we talked about Monday. All right, so a couple of facts for you guys is heart disease is the leading cause of death in the U.S. More than 24% deaths are caused by heart disease. And then respiratory disease is third with more than 5%. It's a pretty big jump from first to third, right? From 24% to 5%. I think it's pretty wild, the difference, the jump there. So let's talk about some respiratory ones. So chronic bronchitis and emphysema are super common ones, and they're most commonly associated with smoking, lifelong habits of smoking. Asthma is another one that you're going to see a lot, and then restrictive lung disease. Does anybody know anyone or have ever heard of restrictive lung disease? It looks and feels a lot like COPD. You're right. In fact, most patients that I've had restrictive lung disease have COPD as the diagnosis, which is kind of strange. A lot of patients, like it says, example up here is chemicals. In my experience, a lot of them have been exposure to some type of a mold that was growing in their house, and it gave them respiratory issues. So it's just something that people don't really think about. A lot of people are under the assumption that as soon as somebody has COPD or a breathing issue when they're older, that they must have been smokers. But a lot of people weren't. Some were house cleaners and got a lot of chemical exposure that way before they really knew how bad it was to breathe in stuff like that. So what are some factors that are affecting cardiopulmonary health? Impaired oxygen transport. That is due to physical inactivity, just not having a very active lifestyle. Sarcopenia, which we talked about in 207, cardiovascular abnormalities, and the non-communicable diseases. And then just lifestyle factors in general. Is their diet crappy, all that stuff. All right, so a CV. Atherosclerosis, high blood pressure abnormalities, and vascular components. What that atherosclerosis is a buildup of fats, cholesterol, stuff like that in the artery walls. This is where you think of as plaque buildup. It happens a lot in large arteries. When it happens in the coronary arteries, this is what we call CAD. Remember that from Monday? Coronary artery disease, CAD. Hypertension is the most common underlying cardiovascular diseases. And then sarcopenia, just to give you the definition again there at the bottom, is a loss of muscle, right? Cool. All right, so ischemic heart attacks or ischemic heart disease or risk factors. What are some non-modifiable ones? Are the same as what we talked about earlier. age, sex, family history, past history. It is a little bit higher in men than it is for women, but it's almost even. It's not much of a difference. Some modifiable factors that we talked about or are going to talk about is high cholesterol, smoking, inactivity, high blood pressure, diabetes, weight, and stress. All put them at higher risk for developing heart disease. So, what are some commonly accepted things to help minimize their risk? Going to a largely plant-based diet, minimizing meats. Plaque buildup is associated a lot with a high fat or protein content, and focusing on healthy fats like olive oils, those kind of things, instead of like your hydrogenated vegetable oils and stuff. Physical activity, getting a low to moderate intensity in their workout or their exercise. Trying to get them up and active is one of the most important things. Addressing their health conditions like, monitoring their blood sugar, reducing their blood pressure, all this stuff. And then the psychosocial factors help them try to reduce their stress, come up with some coping mechanisms, whatnot, because that all puts them at higher risk of developing heart disease. Some smoking-related risk. Smoking is documented to contribute to cardiovascular and pulmonary disease. COPD is strongly associated with smoking, and is the leading cause of. It is among the leading causes of premature death. Stopping smoking can reduce risk significantly. I mean, we kind of know that. You guys ever seen this picture? It went viral, or a version of it went viral for quite a while about, the benefits of. If you guys go on that PowerPoint, you can copy and paste this, keep it as a handout. I've given this to several patients, and it's helped give them a little bit of a motivating factor to stop smoking. 20 minutes after smoking, the heart rate and blood pressure drop back to normal levels just within 20 minutes of not smoking. After 1 to 2 weeks, circulation and lung function start to improve. And it goes so on and so when you get up 1 to 9 weeks, that the smoker norms like a constant cough and shortness of breath become less pronounced. The tiny hair linings in the lung work normally again and clean the lungs to reduce the risk of infection. And then after 15 years, the risk of heart disease is equivalent to someone who's not even a smoker. Pretty wild to see that difference, right? Just after, there's benefits from a short amount of time, and then there's benefits from, long time. Some other factors are hypertension, diabetes, obesity, and cancer. A quick YouTube video I want to show you guys.
Hello, everybody. It's Glenda. And Rosie. AKA GK Freeland.
This woman has a YouTube channel about COPD and life with COPD. Okay, she gets kind of silly from time to time, as you can see with the puppets, but she does a really good job of showing you what life is like with COPD. So I highly encourage. This is about a 15-minute video. I think we've reviewed COPD enough for for in-class lecture stuff. But I encourage you to go watch this video on your own time. Okay, but I want you to see, she's all about it because she's living with it. All right, so let's talk about hypertension and stroke. Is there any questions so far? Mainly review stuff, right? Okay, so hypertension and stroke. The risk of stroke is well understood, but hard to improve. Someone might be at a high risk of stroke, but they have lots of different factors. They may have a clotting disorder. They may have high blood pressure, all these things. It takes a lot of work to try to get it regulated to where they're not at a higher risk of stroke. Hypertension is closely associated with having a stroke, but control of hypertension may or may not reduce the risk. Just because someone, if they have been diagnosed with high blood pressure, but they're keeping it under control with medication, that doesn't mean that their blood pressure can't spike one day and cause them to have a stroke. It's very risky with hypertension. Some other risk factors for stroke include if you've had a previous stroke, you're already at a higher, likelihood to have another. Reduced exercise endurance, smoking, AFib is common. A lot of people don't know that heartbeat abnormalities put you at higher risk for stroke. They think it's just for heart attack. But anytime you mess with the heart, you're also messing with the brain because the brain uses so much of your blood supply to function. Hyperlipidemia, diabetes, smoking, alcohol consumption, all of which are, huge risk factors. So diabetes itself affects 387 million people worldwide and is expected to go to 592 million by 2035. Why do you think diabetes is so freaking prevalent? I think everyone knows. It's almost as common, like everyone knows somebody who has had cancer. Everybody knows somebody who, at least one person who has diabetes. Why do you think it's so common? All the added sugar, all the added stuff in our diets, for sure. Lack of exercise, absolutely. Our world revolves around, our phones now, and we're sitting right here. Or, a lot of the older generation likes to say, "Oh, you always on your phone." Well, they was always watching TV. So they consumed and had a, sedentary lifestyle too, but it was more of watching TV all the time. Impaired glucose intolerance is a marker of vascular complications in large and small blood vessels. What that statement means is that if you have glucose intolerance, which is diabetes, it puts at risk your blood vessels. That's why it takes a lot longer for someone with diabetes to heal on extremities, even with small things, because it doesn't have good blood flow. It damages those blood vessels. Individuals with diabetes have a high risk of cardiovascular disease, as well as numerous other long-term consequences. Metabolic syndromes refer to risk factors like obesity, hypertension, insulin resistance. All of this affects 47 million people in the United States have some metabolic syndrome, like diabetes and all that stuff. It's pretty wild. The last one we're going to talk about is obesity itself. 61% of the U.S. population is considered overweight. Obesity is commonly linked with insulin resistance and high blood pressure, especially if it goes untreated or, the person doesn't lose weight. Cancer is another one. Most cancers directly or indirectly affect cardiopulmonary and vascular systems. It really depends on the type of cancer, where it is, how aggressive. All that stuff goes into the person, their health history. All of that goes into cancer. And we're going to talk about cancer later in a much more in-depth type conversation. But for today, that's pretty much what we need to talk about. There are some extrinsic factors. These are secondary effects from medical care that the individual may be receiving. What do you think that means? This is just another way to word something we've talked about multiple times. Cassidy, extrinsic factors. What does that mean? What are they? Because of something outside of the person. So this is like their response, factors that affect their response to having a cardiovascular disease or issue. Their response with our intervention or something outside of them. Environment changes, stuff like that. Extrinsic factors. Intrinsic factors are exactly the opposite. This is things that the individual can or can't change. sleep deprivation, getting more sleep, nutrition, changing their diet. Some things they can't change is their history and background and stuff like that. And then, as always, I've kind of talked about this a bunch of times, but home exercise programs are huge with people with cardiovascular diseases. You need to give them something that is, for lack of a better word, just right. Something that's not too hard, something that's not too easy. It needs to be slightly challenging to them, but not put them down for 2 hours like we talked about before. You need to make sure that, you're promoting good health with these people. So not just giving them an exercise program or a home activity program or whatever, but also talking to them about, hey, maybe we should talk about, you weaning off some of these cigarettes. And here's some helpful tips. Here's the handout, that I showed you guys of the benefits of doing it. What do you think would motivate you to stop smoking or weaning off of smoking? Teaching them about a good diet for whatever their or substitutions for their diet. For whatever issue that they have going on. All of this stuff is well within your wheelhouse to teach them about. But whenever you do in any kind of exercise training, again, it should always be clear as possible. They should have no questions when you leave. And they should be able to do it without your help. Okay?